as a foundation for public sector, and when it comes to use of AI. And our proposition is that AI is increasingly becoming part of the public digital infrastructure. This is how governments operate. This is how multilateral organizations operate. They use AI as a foundational element. So trust is very, very critical in this whole use of AI. So it is fundamental, in our opinion, to adoption, because it is being used both to deliver services by the public sector, but also, more importantly, for strategic decision making. So we have to make sure that we use AI, we use it correctly, but we have to ensure that it operationalizes trust from the very beginning. It's not something that you can layer in later. It has to be assurance by design. You have to make sure that you're thinking about this trust element right from the get-go. And as a strategic partner supporting the entire UN system, we see this as a key element of what we deliver for our partners and users, which is the entire UN system. All of them are on the same journey at different stages, at different points in time, from experimentation of using AI to implementation to productionization. And in that entire journey, we are making sure that we weave in these elements so that that trust is baked in. What we're seeing is that AI has been deployed in many point situations and point solutions, but it is implementation at scale where the challenges exist today. And in order to scale this up, there are 4 elements that we think are very key. One is, what are the right governance mechanisms? Who's deciding which AI to use? Who's deciding which data sets to use? Who's deciding how is this being trained? So that whole governance aspect is very critical. Second is technical safeguards. What happens if something doesn't go as per plan? What happens if it gives you erroneous information? Right? So that safeguards are important. A third is human accountability. It cannot be that the AI delivers some results and then nobody's accountable if it's giving you the wrong information. So that is a third element of human accountability that we believe is very important. And based on real experience of building and delivering AI systems for many years now, including pre-gen AI, we believe there's an aspect of ongoing oversight. That is very important as well, because it's not good enough to deploy systems and launch them off into the wild. They have to be maintained and managed and monitored continuously. You have to keep enriching it with fresh data. You have to make sure that it remains bias-free. So all of that effort has to continuously be put into it. So there has to be a game plan, both in terms of cost, in terms of people, of how do you sustain this in the long term. So that's what we mean when we say responsible AI, is to have thought through all of those things, not just the flash and the bang and the big press, but how do you sustain it in the long run for the public sector. So Anusha will speak hopefully about some of these examples later, but the AI hub that she has launched and that she's running for us at UNICC is focusing on some of these elements. So for example, we have built shared experimentation platforms because that also goes to good value for money. If all of the UN system can use the same basic platforms to test out their AI solutions in a safe, secure manner with the right guardrails, if they can reuse elements that have been built for one partner, it all goes a long way. So those are the kinds of things the AI Hub is working on. Guidance and governance discussions, that's another area we're focusing on. Access to common tools and methods. And in that focus of access to tools and methods, what we're really looking at is open source AI. There are commercial products that are out there available in use within the UN ecosystem and beyond, but we are consciously making a choice to also look at open source AI models, because we want to make sure the widest variety of AI platforms are made available to our users, and they get to choose which solution to use in which context. So with that in mind, we have been looking at open source AI coming from different parts of the world. We've started looking at the ones coming from India, but we're looking at European models, we're looking at models coming from the Middle East, as well as from the US. So what we're trying to do is curate a set of ideas, curate a set of models, platforms that our partners can use, so that AI that's being deployed has institutional trust. Everybody who's using it trusts that this is fit for purpose, that it is the best possible solution at this point in time. And then we want to make sure when solutions are being rolled out, if it's a sensitive solution, you have elements like human in the loop. You have somebody who's looking at it, making sure that a person can intervene and can help modify, if need be, the output coming from the AI. One example of that is a solution we call Unify HR. It's a relatively simple HR bot that was built for 13 different organizations across the UN. And with our technical leadership, we've scaled it to a point where it's being used by now I think more like 15 organizations. So all of these complexities of the different needs of each organization, they have staff members in hundreds of countries around the world. Is the solution working in context in those countries? We have to keep all of those elements in mind. How do you make sure all the documents that need to be secured, HR details of individuals are kept secure? Continuous improvement, governance, feedback, all of those elements had to be thought through. So I think what we have learned is to really launch trusted AI, we also have to look at one more element, which is organizational readiness. People have to be willing to use it. I remember when Gen AI came out, there was this mad rush to deploy. After a while, the messaging that I started to hear was, all of this will fail unless the people. And I don't mean just the technologists, but every person in your organization or every person or the constituents who will be using this AI understand how to use it. So that human readiness is very, very critical. And that's another aspect of the AI Hub, is AI literacy. We're focusing on that to make sure the constituents who will use this AI know how to accept it, know how to use it, and also provide mechanisms where they can tell us, is this working for them or not? Because sitting where we are, we might say, hey, it's fit for purpose, but do the end users actually agree? That's a very valid question to be asking them. So AI literacy, accountability structures, change management capacity, it sounds boring. Sometimes it's not the flashy stuff, but that's what sustains it and scales it in the long run, in our experience. So we really want to focus on this and want to make sure that as we go from pilot to production to global scale, all of these elements are kept in mind. I think I'll pause here because we have a very interesting panel that we would love to have jump in and provide their insights. But I hope you learn a lot from them about how should we make sure that all these elements are kept in mind. And so will I. I look forward to this discussion. Thank you so much.
Thank you, Samir. Now I'm going to take the opportunity to bring and invite Dr. Andra Lucigi. She's the resident representative of United Nations Development Program. Ma'am, welcome.
Thank you, Anusha. Good morning, everyone, distinguished panelists. It's a privilege to speak at this AI Summit because it's about impact. And it's really on how the public sector can drive responsible adoption at scale. And my thanks to Mr. Samir Chauhan, Director of UNIC, and all the partners who brought us together. And I think what is so significant about this moment is that it's the first summit that's happened in the Global South. And the fact that it's happening in India is just telling. It's signaling a shift to where ideas are being shaped, whose priorities are being centered, and of course, how AI can serve development. At UNDP, we start with a simple test. Not how advanced technology is, but whether it measurably improves lives, especially for the people who are least served by today's systems. And that's why we see AI not as a technological upgrade, but as an enabler of human development, equity, and resilience. That's only if it's designed and governed with public purpose. And let me just give an offering from India as a powerful frame for this moment through the 3 sutras of people, planet, and progress. because it places public purpose at the center of how AI is built and deployed. Let me begin with people. If AI isn't making it easier for a mother to get a vaccine appointment, or for an ASHA worker to complete a visit without a whole paperwork load, it's not doing its job. So a quick example is the immunization platform, UVIN, which shows what practical people-first AI looks like. UVIN is already piloting voice-to-text tools for nearly 1 million frontline workers. They can speak in their local languages and have the systems convert it into a clean digital record. This cuts mistakes, reduces the workload, and frees up time for care. And UVIN will also be integrated with AI-enabled multilingual chatbots to provide real-time guidance on immunization schedules, vaccine availability, and platform navigation. This kind of reliable information that's available 24/7 strengthens trust in digital systems, as was mentioned just now. It improves access, particularly underserved communities. They trust the system, so they will use the system. And UNDP has been proud to support the Ministry of Health and Family Welfare in rolling out UVIN and integrating these AI-enabled capabilities. But we're also working with other partners and state governments to see how this AI-driven early warning mechanism can be used for zoonotic disease outbreaks. Because we feel it's so important to integrate animal and human health data streams. Because the whole point of the system is to use data to guide policymaking and decision-making and provide that extra shift that is important so that we're not just reacting to outbreaks, we're anticipating them. And now for the planet. For millions of Indians, climate risk is already a daily reality. Heat waves, floods, there's a lot going on. And in many districts, small changes in rainfall or temperature translate into large shocks for income, for food security, and well-being. Here, AI has the potential to turn complex data into timely, local, actionable decisions for farmers on one hand, but also for policymakers. Yesterday, we witnessed the launch of Bharat Vistar, which is an AI-powered multilingual tool designed to provide information to farmers in their own language via mobile or simple call. And I think it's so important to highlight that the technologies in India work in high resource environments, but also in low resource environments. So mobile first is really critical when it comes to adoption. This tool will offer guidance on crop planning, packages of practices and pests, and also weather forecasts, markets, scheme information, eligibility application, and grievance. And why is this important? Because we're trying to reach the smallholder farmers. We're trying to reach women farmers, so a diversity of farmers. So it's really, really important that we see this tool as something that's expanding access. It is also about improving early detection and response. There's a national pest surveillance system which uses image analytics to identify crop threats faster. So you just take a picture and it will translate into real evidence. And then tools such as YesTech and Cropic, which UNDP supports with the Ministry of Agriculture, they make crop insurance more transparent and also speed up claims. For farmers, going through their claims faster means higher resilience and better ability to cope with the changing weather patterns. So these are examples of how AI can strengthen nature-based livelihoods when it is built on public delivery, but also grounded in the realities of rural India. And finally, progress. If we want AI to deliver at scale, we need strong foundations. And this is where India's digital public infrastructure is a global reference point. DPI creates shared digital rails, and it helps innovators reach citizens affordably and reliably, not only in big cities, but also in districts across India with different languages and different income levels. And I believe that is the logic behind India's AI mission, widening access, building blocks of AI so that we can include compute and ecosystem so that innovation is not concentrated in a few hands, which I believe is so important going forward. But reach is not enough. Scaling AI depends on progressive adoption. A promising prototype has value only when it turns into a trusted public service. And this is where public sector leadership is very decisive. Adoption requires interoperability, it requires ethical data use, it requires inclusive design from the start, as we've heard, and it also requires clear accountability if and when systems fail. And it requires safeguards so that AI does not amplify bias, and it does not exclude those who are offline or erode trust. So at UNDP, our approach to people-centered technology and AI-driven social services is rooted in one thing: listening first. We have learned that meaningful long-term impact rarely comes from one-size-fits-all solutions. It depends on people-centered designs that are grounded in local context, language, and trust. We position AI as a powerful accelerator for human development and a healthy planet, and which is a core pillar of our strategic plan for 2026 to 2029. Let me close by this. The public sector does not need AI everywhere. It needs AI where it reduces inequality, it improves service quality, it strengthens resilience, and it earns trust. If we keep people, planet, and progress at the center, India can continue to show that responsible people-centric AI looks like at scale, across a global south. It can help to define a global approach that is fair, practical, and grounded in real outcomes. And I'm happy to say that India is already doing that. There are so many countries who are already benefiting from all the tools that are available because, as you've said, they are open source. So really, what is built for India is actually a global public good. Thank you.
I think without further ado, one of our colleagues will be joining us in a few. I think we can get started. I'm going to introduce our panelists today. So we do have Dr. Manish Pant. He is our policy specialist, digital health, and from UNDP headquarters. So thank you for joining us, sir. And we also have Robin Scott, as she's the CEO and the co-founder of Apolitical. Thank you for joining us. So without further ado, maybe I will start with you, sir, Manish. So where are we when it comes to responsible AI deployment, and what does it look like in practice? Because we are looking at Gen AI not only in digital and public health. Please, can you please share your perspective from digital innovation? How do you see the health progress?
Yeah, thanks, Anusha. It's great being here. I think I'm going to build up a bit on what Samir and Angela spoke about. And I'm going to be specific for the health sector. We have to see AI in the health sector from the value that it brings, as Angela also mentioned. And for that to happen, what I always like to say is that the value of AI in health comes from when it is built around the public health priorities, not the technology per se. When it is embedding the user's need, they want timely and efficient health services. When it is embedding the health priorities, I think the health priorities should drive the technology adoption. And I don't mean diseases per se. Think of health priorities like supply chain management or continuity of care or treatment adherence. These are some of the challenges. And then how does it all bring efficiencies in the health system? Does it reduce stockouts? Does it improve number of people who are put on TB treatment programs? I think we have to see the value from the health outcome perspective. Samir also talked about the outcomes as being the drivers of value. So if we build an AI system that improves documentation in the health system, but it increases the risk of, clinical decision making, then that's not a value. But if it is reducing stockouts, wastages, it is improving, as I said, TB adherence, then that's a value add. So I think we have to frame this, the value from the services and the outcomes. And trust and safety is a very important value to have. Any AI system that is not governed well, that lacks accountability, you as a patient would not want to be sitting in front of a computer and the computer is making decisions and prescribing you medicines. So that is not a value add. And the last value that I see is the economic value. You're talking to decision makers to scale AI systems. The health budgets are already very limited in most countries. How do you bring in additional AI money? So this is where the value of, through investment cases, documenting case studies, return on investments. In India, we have done a lot of good econometric assessments of these CoWIN even systems. These bring the value, economic value also. Now, if I was to take and talk of scaling these systems, since you mentioned about responsible use of AI, I think scalability has to be embedded in the public health workflows and the programming standard operating procedures. This is exactly what we have done in India with the Ministry of Health, is not adding a disruptive technology, rather enhancing the program workflows. And in this scenario, what happens is everybody knows what's happening. The health workers know what they're supposed to do, how to use AI, is it making the right decision, when to use AI, when not to use AI. Patients know whether my data is safe or not. Regulators need to know which technology to deploy. I think these are some of the critical elements in a value-based scaling up of AI in health. And this is how you pick out deployment patterns. There's no one AI and it suddenly scales across the whole system. You have to pick, you start with chatbots and you start with clinical decision supports and then you scale up. But there are challenges like AI is, one of the major challenges in the health sector that I see when you're looking to scale is the fragmented nature of the health data. It's very siloed, it's very incomplete, it has data quality issues. So even the best AI models will struggle to give you relevant, valid outputs in such a scenario. So that's always a challenge. And I think skilling is another aspect in the health sector which drives value, but it also drives trust and safety. Last year the UNDP's the Human Development Report talked about using AI not to replace health workers, but to augment their skills. We need to have our doctors, our nurses, our community health workers adapted and skilled on using AI in their routine work and not fear that it is going to take away my work. At least in the health sector, I don't see that happening. I cannot say about other sectors. So, and when I say skilling, I don't mean one-off trainings. It has to be a regular, ongoing mentorship model. And again, I refer to the work we do in India on a very efficient model of mentoring and skills. I think the last point from my side would be then, and this is also a UNDP kind of a policy position we are taking around health and AI in digital is, so how do we deploy AI in health sector? I think we have to find that repeatable pathway of AI use in the health sector, not one-off pilots. So I guess we look towards some benchmarking of technologies that are, low risk chatbots to high risk triaging systems. So technology should have some benchmarkings, and we're looking to WHO towards building those. So the low risk technologies can be deployed earlier. Chatbots, appointment scheduling kind of technologies can be deployed earlier, whereas triaging and clinical decision making can come later. Then how do we make its safety? I think the governance and accountability systems are critical. I always advocate for, as a UNDP, person, human in loop design. The results of the outcomes of the AI system in the health sector have to be validated, approved by human beings, and then that also brings in the accountability, because who is then accountable for a wrong decision? Is it the technology or is it the human resource person? And the final point, I think Samir talked about it, is I think we need to invest a lot more in foundational elements of digital. I'm talking of health-specific digital public infrastructure, which will be interoperable data systems, standards, registries. That will be the foundational blocks of AI used properly, as Angela mentioned about UN. So I think these are some of the top points in my head in terms of a value-based, safe and trusted AI in health sector.
Thank you, Dr. Manish. This is very helpful. Definitely shared understanding and AI assurance mechanisms. These are some of the things we do want to build in collaboration with the governments and also with international organizations. That kind of segues into what you do, actually, Robin. So, from AI training and AI literacy, where do you see, what are the biggest readiness gap? And from your perspective, how do we improve AI literacy?
Well, it's so nice to be here. Thank you for having me. I'm very proud to partner with the UNICC on the hub that you run and that Samir mentioned. Just a bit of context on where I come from. I run Apolitical, which is an online network for government. We do a lot of training on responsible AI use in government, and we have now almost reached 400,000 public officials trained globally. So it is from that data and perspective that I'm speaking. There are a lot of gaps. I think that's the first thing that should be said, and there is an asymmetry between talk and increasingly pilots, and then at-scale deployments that really make a difference. We have a lot more talk and pilots, and still relatively few life-changing, planet-saving at-scale deployments. That will happen, but we're not quite there yet. So I'll just acknowledge that. Readiness, government readiness, plays a big part in slowing that down. We have surveyed now 8,000 people globally, have some really interesting data on this. The first and perhaps most alarming stat I'll give is that of those people implementing AI in government around the world, these are people whose job it is to do the implementation. Only 26% of them say they are familiar with the ethical frameworks of their own government. So 75% of implementing implementing AI are not doing it even with their own government's frameworks in mind. So there is a readiness gap even within the institution. Forget understanding the technology writ large. Then, of course, we expand to the technology writ large. There is lots to say about readiness, but I'll just reflect on a few points. We hear, for example, that from 70% of leaders say they have AI pilots or they're about to run them, but only 36% of them have plans to get their organization's data AI ready. I think that's an interesting gap for sure. Only 20% of public servants are clear about the skills they need in order to use AI effectively and responsibly. So that's another interesting gap. And the next gap, and I'll end here, is that we've moved from a get literacy right, get fundamentals right, to how do we personalize AI readiness for everyone? So in an old world of learning, you had a few personas. You had leaders and implementers and users, and you had specialists this and specialists that. But now we think you have as many personas as you have people, because every single individual, every one of the 200 million public officials in government around the world, 600 million in the wider public sector, everyone has a slightly different job, and therefore you need readiness and training that is hyper-personalized to your role. And that's the frontier of what we're building out, and we're excited to work with the UNICC on.
Thank you. Thank you, Robin. I think that I would perhaps segue into the second question or the second topic that I wanted to bring to is, see, some of the adoption risks that we do see are often cultural, not technical, right? What are these minimum AI sort of literacy standards and the role-based versus general awareness? Like, how do we avoid this checkbox compliance of training and AI literacy? Can you shed some light on that, please?
Sure, and so 100% culture is a massive factor. And just to build on the report Manish was quoting, we talk way too much about automation and way too little comparatively about augmentation. So while the public sector is optimistic overall about using AI, like very optimistic, by some of our data, it's upwards of 90% of public servants are optimistic. People are also frightened, and sometimes that's an unstated, maybe even subconscious anxiety, because you have political leaders with squeezed public budgets all talking about saving money with AI, with Reid cutting jobs. Now, that's not how you affect change, and it also doesn't make sense, because if you could make every public official 50% more effective or 100% more effective, if you could turn the value to people of every one health worker into 3 health workers, the budgets would feel a bargain by comparison. So we need a lot more of that, a lot more human-centric AI deployment. And with that, we need to talk a lot more about agency. And there is an internal responsibility of AI point that I think is really important. It's all about how do we make the tech responsible for people, and that is critical. But how do we also do it responsibly towards the people in the public sector being affected? And that's about keeping agency. Right now, there's a zero-sum dynamic. AI is getting all the agency, and we want agentic AI, but we need to lift up humans. We need agentic humans at the same time. One final point on culture. Again, there's plenty to say here, but it needs to start with leaders. If they don't embrace it, others won't. And I was in Davos, I was interviewing Abhishek Singh, who leads the AI mission here, and he was saying that when the Capacity Building Commission put out their first AI courses, the Prime Minister said, which courses do I need to do? And I think that's what all heads of state need to be doing.
Thank you, Robin. That kind of brings the awareness that India has right now. And I think I would segue into this topic, especially from a healthcare perspective, right? Dr. Manish, where do you see, what value are we getting? And how do you see these smaller states actually implement these assurance realistically? Like, how do we assure the minimum safeguards do exist before we deploy?
I think it starts from the top. The real political leadership investment is needed. And I don't really mean governance from a bureaucratic perspective. You have countries like Bangladesh and others where the AI hubs are embedded at the Prime Minister's office or the President's office. Really the mandate for building this value and governance and assuring the people of safety and trust comes from the highest political leadership. But then also there is a need to strengthen the regulatory frameworks and the authorities and building their capacity to manage the validity of these results. You know, I was talking to you offline that the US FDA struggles with software as a medical device. I think recently they have, how do you say, widen the scope of technologies that can be included, which I think is a little scary. But I think the regulation and the regulatory authorities really need evidences that these technologies work. You know, like you have clinical trials, we should have health technology assessments embedded in design, you know, and there should also be a co-creation design where right from the time these algorithms are being developed, maybe we need health-specific models now. I strongly believe we need health AI models. So the co-creation should be between the health professionals and the technologists so that we know why the algorithms are giving the results they are. So there is a health buy-in right from the co-creation. But this co-creation should also involve people, the civil society, in terms of they should have a seat at the policy level so that they understand why the AI technology makes sense and where there are the challenges. So I think it has to be a combined effort at the regulatory level, at the political level, involving the people, community, to ensure that the accountability mechanisms are well framed out. And I think that will drive the safety and trust into the systems.
Yeah, and perhaps I'm going to ask the same question to both of you. Like, how does AI literacy improve safe adoption? Training and upskilling, does that help with responsible AI and safe adoption of AI?
I think it has to help. I mean, you only have to ask yourself the opposite, or imagine the opposite, where no one has training. I think particularly, obviously, not all literacy is created equal, but if you have good literacy work, you start to get a sense of, first of all, how the technology works. It's really important that public officials understand this is, AI is not thinking, it's doing pattern recognition, because once you metabolize that concept, you get a much better grip on how it could go wrong. It is really important at the leadership level, and this is something we see again and again, for leaders to have literacy that includes them using the technology, because too many leaders tend to look over their kid's shoulder or their grandkid's shoulder, and AI is not a technology that you can understand in the abstract. You have to use it to feel the delta of change in it, to feel the capabilities. So there are lots of things that can be done at the literacy level that can definitely help responsible deployment. I'll make one final point on this, which is that you are only as good in some ways as the extent of your literacy. This has to be an all-of-organization capability, because it's like speaking a new language, right? It is such a radically transformative technology, and any government that approaches it just like a technology rollout is going to cheat responsibility. It needs to be approached like a full transformation.
Yeah, I think to add on to what Robin said, I'm going to say that when we are talking of skills, literacy and skills, I don't mean that we are looking to convert health workers into coders. We're talking more about their ability to use the technology properly. So to that end, I'm going to draw on some of the experience that I personally have also had with our work at UNDP in India, in Indonesia, in Malawi, now in Zambia, and other countries. The health worker at the last mile, particularly from a scaling level in a health system, is a key person along with others. So to build their skills, you have to see that how can you make them see the added value of the technology. It is no different from the digital technology applications 10 years back. AI is just another technology which makes its own decisions. But the health workers, once they are not scared and they see the added value, it should augment their work. They should see that my work is not getting disrupted, rather it is getting enhanced. We have seen women, at the last mile, semi-illiterate women, never held a smartphone in their lives before. Suddenly they're entering the data, and they're very happy. So once the technology is seen as being empowering for the users, the adoption scales up. It's a cultural phenomena, but even you and I behave the same, don't we? So I think this is very critical. And the skilling also from the user's perspective, they should know when a chatbot is giving them blatantly wrong information. You learn this. So there has to be a constant education around AI, at least for in health, on what is correct, what is not correct, for health workers, how to use it, how not to use it. So yeah.
Thank you, Dr. Manish. I think focusing on designing workflows where actually the humans retain the accountability and auditability and the traceability for AI, and it's no longer AI-enabled decision; it's AI-assisted decisions that actually help us. And I completely agree. And I think we haven't gotten our colleague to join us, but I think to summarize and conclude this panel, I think practical guidance for safe AI deployment in public sector, and also having a shared understanding of AI assurance mechanisms. And we do see that capacity building, as Robin and Dr. Manish pointed out, insights for governments and international organizations will come only when there is responsible scaling baked into the design of how we are actually scaling Gen AI, not only for the UN organizations, but many of the agencies who we are collaborating and working with. I thank all of you, Samir and Angela. Thank you for being here with us, and thank you, Dr. Manish and Robin. Oh, sure. Yes, sir. Yes, sir.
Thanks the experts on the dais. It was a very, very fruitful discussion you had. Of the 4 speakers, 5, you are the moderator. Basic topic today, what we have discussed in the forum is on the health sector. Now, I am from the public sector in India, worked for 25 years in the public sector in all domains. Now, we have not talked about the policy of the AI in the public sector, namely the power sector, steel sector, fertilizer sector, oil and gas sectors, infrastructure, defense sector. So, number one, because nobody is from the government of India on the panel, we have to have a policy for the public sector that what policy has to be adopted for the AI, number 1 point. Number 2 point is that each public sector is different in its own domain, in its own specialization. So a single policy cannot be adopted by the each and every public sector because they have got the distinct working environment, different discipline of operations. So we have not discussed on, we have not thrown on this light on that. And what we have discussed that Dr. Pant and Angela, they have discussed broadly on the health sector. Now on the health sector, because I am a ground worker in the health sector in all the states in India. Now this week, in Madhya Pradesh, a sterilization has taken place. And the patients are on the floor, 2 minutes sterilization of the woman. Where is the artificial intelligence? Where are no doctors were there? No nurses, no medical staff was there. So what, because here all educated people are there, all educated. We have to, as Dr. Pant said, that we have to go to the masses. So we have to go to the masses because first AI, the educated people know what is AI, little bit. But the man on the road, man on the village, man on the tier 2, tier 3 cities are still to come up with this. So it is good. We have discussed on the, basically on the madam talked about 8,000 or 7,000 workers all across the world. You know, you talked about general awareness among the citizens of countries all around the world you talked about, the training you talked about, and optimistic about the public sector you talked about. These are topics. So thank you, but I request Anusha that the points which I have given, if it can be taken with any of the sessions here or tomorrow or at the Bharat Mandapam. Thank you.
Thank you, sir. Point well noted. We will consider the questions that you shared with us, sir. Thank you so much.